So you want to build an app. What does this target population look like? And after a few of these slides, I'm going to stop and we'll have a chance to chat a little bit. So when you look at this target population, this is out of a 91 student survey. This covers all 3 of our classes. And we are trying to figure out who is this group, what do they need, and have the apps been beneficial to them. So this can be an encouragement to you that the things that you're thinking about building or want to invest your time or money and expertise into, this is the students talking to you. So clearly, they're all millennials at this point. We occasionally have a second career student, but they're all millennials, all 91 of them. If you look at their learning styles, you'll see that they want to put their hands on stuff. They did not really want to just sit there. So they want to engage, they want to try things out. So they're kinesthetic and they're visual. They want to see stuff. And you'll see in their comments how that all ties together into why we need to build these kinds of tools for the future of learning. You can see that when we ask them, how many of you use these mobile devices prior to starting DPT programs? You know what? They're coming in with these devices ready for you to access their brains. Laptops and smartphones, they all have them. Okay? Only about 30% of them have tablet devices. So when we build apps, we always build, when you build the apps, you always build a version that works well on a smartphone because you only have so much screen real estate. And then you have another version that you can work on tablets because you have typically triple the real estate. So the experience can be different. You can organize that different. These are all little things that you don't realize till you get towards the end. So, did they consider themselves technologically savvy? In general, most of them are pretty okay. All right, so that means that in general, I think students can handle and actually looking for utilizing these types of tools for learning. So before starting the DPT program, how many in an average day, how much time did you spend using your mobile device? The largest group, 3 to 4 hours. This is what they look like now in the DPT program. Okay, 7 to 8 hours. So they are accessing mobile tools no matter how, whether you think they're reading your textbooks or not, you know they're telling us that they are spending a third of their day accessing media, accessing knowledge through digital devices, mobile devices. And please feel free, guys, at any point, shoot me a chat or a question along the way, because I'm kind of monitoring it so I can be able to answer questions as we go. How valuable was it to have the iPads required for your curriculum? And you can see the vast majority have said having some type of uniform platform. We at our university require iPads. The bulk of them had it. The group that didn't were forced to get iPads. The beauty of it is the experience is the same, meaning the students I can expect to give them a very similar experience, and I kind of get to leverage the power of having a unified platform, even though we built it for all 3. So rate the course apps. So we have generally begun building apps to augment the classroom in every major class that you would teach in a PTA and PT program. So we asked the students, are these useful to you or not? And you will see that over 90% of them are saying, or probably close to 90% are saying, very much so, it's useful to us. Do you see a downside to integrating these apps into the DPT program? And again, the vast majority will say, no, we actually benefit from it. So this, I think, is very interesting. So in what ways did you use the course apps? So give me 1 second, guys. 1 second. Hi, Abba. I'm running a webinar. Okay. Sorry about that. So you'll see, in what ways did you use the course apps? Well, I want to point out that the big percentage of them used it to prepare for lab. So even before coming to lab, they were looking at their techniques. Okay, so that's one of those powerful things. I use them during lab to watch and review techniques, right? So they never have to worry about just seeing it once. Their exposure to content can happen at any moment that they have the interest or they have the time. I use them after lecture and lab to review in my own time, 92%. I use them to prepare for written exams. I use them to prepare for practical exams. And half of the class, more than half the class, are using them all the way into your clinical rotations. So you have to ask yourself, are my students using my textbooks all the way into their clinical rotations? These apps follow them in their pocket from the beginning of class, even before you teach content, all the way into the clinic. In fact, we're running a pilot study right now where we are inviting CIs to use these apps with the students. The CIs get to see generally what we're teaching, get the concepts behind how we manage things, and the students engage with the CI with this type of guideline-based apps that help to normalize how we expect students to practice in the clinic. So interesting data. And also to note that, yes, I actually skimmed through this before my course even began. How many of your students are skimming through their textbooks or their notes before the courses began? So you're beginning to expand, break out of the boundaries of the curriculum is what I believe we can do, right? Is essentially say, I'm no longer trapped. My students are no longer trapped by the little classes that I teach 2 hours a week. In what ways were the apps most helpful? So I know you can't see that very well here, so I pulled it up in a different way. So this is the responses. In what ways were the apps most helpful? Okay, so pulling it up to learn and review in my own time, loved it. Provided a visual demonstration of techniques, loved it. Helped me to prepare for practical and comprehensive exams, right? Because now in their hand is the app that pulls together stuff that I learned in Ortho 1, Ortho 2, range of motion manual muscle test, you know, my TheraX class, all of it's in one place. It helped to develop my clinical reasoning. It reduced my anxiety during lab so I did not have to record everything. Almost half the class said, hey, it makes my education more affordable that you've given me or helped me to get these resources. And it does make information more accessible. So, please rate, we asked the students, please rate, based on the utilization of the apps, what were the effects on the student? So I basically broke it out this way to give you a summary of the people who rated this as very, very helpful, greatly affected me. Okay, so here, it helped me to develop mastery and confidence of the content because I could revisit it. I could look at it from different perspectives, and I'll show you glimpses of how we think this happens. But yes, mastery and confidence, preparation for the clinic, 64%, it greatly or largely helped. Synthesis and learning, right? This higher level of learning, 80% of the students pretty much are saying, this helps me to take my learning to a higher level, to connect the dots. That's primarily why I built this whole series of orthopedic apps, because I felt like I was delivering information in little bits, and I could not contextualize from the big picture how all of these pieces fit together. And clinical reasoning, helping with my clinical reasoning. Again, many of our apps are built around patterns. How an exam ties to the treatment, ties to the therapeutic exercise, ties to the patient education. All of those pieces tied together. Here is the other set of things that they mentioned about. Reduce my anxiety in lab, help me to become more efficient, and added to my development as a student clinician. So, here is today's view of textbook usage, of which many professors I have spoken to, and I believe many of you are in the same boat. The cost of the education is extremely high. How well the textbooks are doing, how they are serving the students' purpose for our teaching and their learning is being, basically the answer to that is the students, greater than 80% of your students, of our students at the very least, are buying less than 40% of the textbooks that you think that they're reading from or studying from. And I think because the model is overly expensive, never updatable, you'll have to buy a new edition every time something changes. And that, you know, that by the time I finished writing my first textbook, it was already way out of date. So there's this challenge, right, that the students face, and they are having to make choices with the little money that they have. Where are we going to spend our time? What kind of tools are we going to use? Which is why we're having this talk today. My hope is to encourage you and to lay the land out to say, this can be done, this is how it's done, and the students desire it. They find it valuable.